Welcome back. Earlier today, the Southern African Development Community had convened via a virtual meeting of Ministers of Health to assess the Mpox epidemiological outlook and develop a coordinated regional response. This critical gathering aims to enhance public health surveillance, improve cross-border disease detection, and strengthen prevention measures to limit the spread of Mpox. Dr. Kalumbi Shangula, a key participant in this meeting, brings extensive experience and insight into public health policy and disease management. As the Minister of Health and Social Services for Namibia, Dr. Shangula has been at the forefront of health crisis, including the COVID-19 pandemic and other regional health challenges. He now joins us in studio this evening. Dr. Shangula, good evening.
Good evening, Nina.
Thank you so much for being here today.
It's my pleasure.
Doctor, just to start with, could you provide just a brief overview for myself and the viewers on the current Mpox situation in the SADC region? What are the most, pressing challenges and concerns?
Thank you very much. I think maybe before that, let me put in context Mpox, the disease we are talking about. So Mpox comes from the word monkeypox. So it's a disease which originally was found in monkeys, and it's caused by the virus, and then that virus which caused the disease in the monkeys, it's called Mpox virus. Now, it is not a new disease. I want to emphasize the fact. It was first diagnosed in 1970. Mm-hmm. And it has been endemic in some countries, in Africa, in Americas, in Europe, but the major cases so far overall were recorded in the Americans, which make up about 64% of all the cases, and about 27 cases in Europe, and 5.4 cases in Africa. And the rest of the percentage, 3.5 for the other geographical regions. Now, it is transmitted from animal to human, and also from human to human. In 2022, there has been an upsurge in the number of cases of Mpox, both in all the continent I have mentioned. This year, specifically, there was an upsurge, especially in the eastern part of the DRC. And it has spread to some other new countries where it was not endemic. In the SADC region, we have two member states of SADC region who have reported cases of Mpox. And DRC is one of them. And on the African continent, the majority of cases they are recorded in DRC, eastern part of DRC, more than 96% of the cases, and also about 97% of the deaths were recorded in the Democratic Republic of Congo. So, given the upsurge in the number of cases, the African CDC declared Mpox as a public health emergency of continental security on the 13th of August. And it was followed by the World Health Organization, which declared it as a public health emergency of international concern. So during the WHO Afro meeting of ministers of health of the WHO region in Africa, the issue of Mpox received quite considerable attention. Now, we also know that in August, SADC held a summit of head of states in Harare. And then Zimbabwe assumed the chairmanship of SADC. And then that summit directed that ministers of health in the SADC region must meet as a matter of urgency to review the situation of Mpox in the SADC region. So today, under the chairmanship of the Minister of Health of Zimbabwe, who is chairing the Committee of Health Ministers in the SADC region, he convened a virtual meeting today, and it was attended by all member states of the SADC regions, where then we reviewed the situation of Mpox in the SADC region. And as I mentioned earlier, so far 2 member states of the SADC regions, they have reported cases of Mpox. Now, maybe of interest with regard to South Africa, which is our closest neighbor, so far they have recorded 24 cases, but their last case was recorded on the 3rd of August this year. So basically there are no active transmission in South Africa, which is ongoing. Yeah.
Just back to my question on the most pressing concerns around the Mpox virus within the region. What are those?
Well, the pressing concern basically is that it has got the potential to escalate into all-out pandemic. So that's number one. The second one is that what is the response to the situation? We know that member states, they are at different levels of development in terms of health infrastructure, health workforce, diagnostic capabilities, treatment, and also prevention in terms of vaccines. So these are the issues which the ministers were discussing today, and they took decisions specifically to focus on surveillance, cross-border transmission, surveillance, to strengthen surveillance, to be able to pick up as soon as possible any case which may arise in any country. And then also to engage the community, to inform the community about the risks and how the community can protect themselves from contracting the diseases. So during our discussion and the decision which were made, which was preceded by the committee of senior officials, decisions were taken to reinforce and also to ensure that we develop domestic capabilities to be able to prevent, to be able to respond, and actually to be able to detect, which is the most important thing.
On that note, what resources and support do you believe, Dr. Shangula, is necessary for SADC member states to effectively combat Mpox?
Well, there must be a regional cooperation, that's number one, because our borders are porous, and with the globalizations, the movement of goods and people is totally, open. Such that I normally say that somebody can have breakfast in New York, lunch in London, and dinner in Windhoek. And so that is the level of, mobility we are experiencing now. And especially diseases like Mpox, which are caused by viruses, which has got a high speed of transmission. It is possible for any country to record a case of Mpox. And therefore, regional coordination is important, especially to strengthen surveillance at ports of entries, but also domestically to have that capacity to be able to detect and then confine.
You mentioned the issue of detection twice now, and it's emphasized on the importance of that. How are we equipping our healthcare workers to be able to do this?
Well, first of all, like for example, in the case of Namibia, when we heard about the outbreak in the DRC, we already activated our health emergency management committees, which had already been in place during the COVID-19. And then we have activated that. So far, they have conducted 2 meetings, and then we have also trained around 300 health workers on detection and also on protection. We also made sure that we have the capabilities in Namibia to be able to detect laboratory. So far, any case which is suspected it will be subjected to laboratory testing. We have so far carried out 18 suspected cases. They were subjected to laboratory confirmation, and all of them has proved to be negative.
Right.
So Namibia is not endemic to Mpox, and Namibia has not detected any case of Mpox up to now. But as I said, this is at the present moment. But I explained the mobility and the porousness of the borders, but we are on the lookout. We have strengthened the surveillance, especially at ports of entry.
Fantastic. Well, Dr. Shangula, that's all the time we have this evening. Any final remarks from you?
Well, my final remark is just to say that any outbreak or any epidemic, it can only be successfully contained by means of vaccinations. At the present moment, there are vaccines available, but not widely available. So far, countries which are affected, they are the priority for vaccination. So there are vaccines which will arrive tomorrow, destined for the DRC and some of the high-risk countries. But I must also inform that these vaccines, they are very expensive. One dose of vaccine costs about $270 US per one dose. So that translates to more than 4,000 Namibia dollars. So at the present moment, for countries which are not recording cases, vaccination is not a priority, but it's the necessary tool for any pandemic.
Right.
What we are trying to strengthen is the normal preventive measure as we had during COVID-19. And I just want to inform the Namibian public that there is no need for panic at the present moment. Anything which we picked up, we will always share with the public. And we will share with the public the correct information. Anything which does not come from the Ministry of Health in terms of information, consider that to be not factual. But thank you very much. Let us remain calm.
Dr. Shangula, it's always a pleasure having you with us. Thank you for your time this evening.
Thank you.